With those bottom line questions in mind, there are 5 main factors we'll need to consider in determining if our services are ethically provided. If we can't manage these factors, then we're not being ethical, and we need to adjust one of the factors or consider if telepractice is right for this client or us at this time. The 5 factors are audiovisual environment, therapist factors, client factors, test and materials factors, and other miscellaneous factors. First up is audiovisual factors. We should assess the sound and video quality of our sessions, which may be impacted by either our or our client's internet speed or the quality of the microphones and webcams being used. In terms of internet speed, you want both you and your client to be running at least 4 megabits per second download, with uploads around at least 1.5 megabits per second, and as low a ping as possible. Try to keep your ping under 150 milliseconds, or you'll probably notice some laggy graphics in streaming. You can check your internet speed using Google or a site called Ookla at speedtest.net. Next, we're going to review some example case studies of ethical dilemmas you may face in telepractice so we can put what we've learned into practice and prepare ourselves for some common situations. Our first situation relates to scheduling and logins. Let's say that you've sent a family your login link several times and walked them through how to log in, but every session they are 10 minutes late because they struggle with logging in. What do? In this case, I would recommend some deeper digging into whether or not the family truly understands how to log in. It may be helpful to get another adult or older sibling involved who can help if tech troubleshooting is an issue. You can also recommend doing a trial login when it's not your scheduled session time to ensure they know how to do it, and follow that up with a brief how-to document for their reference. In this, I'd include the login link, schedule, password if needed, how to access the link and sign in, how to get peripherals working, and your contact information. If all that is done and they're still struggling, it'll be up to you to determine if this client is a good candidate for telepractice. 10 minutes every session does add up, and depending on your contract, they may not want you to bill for time you're not actively with the family. I disagree with that and think you should charge for the full session, but again, it'll depend on your contract.